question here is, do you currently use the Spaulding classification to determine the minimal level of disinfection for reprocessing endocavity probes? Yes, 26%. No, only 8% there. Not sure, 32%, and not aware of the Spaulding classification, 34%. So fairly even distribution between yes, not sure, and not aware of the Spaulding classification. We will be going over those in just a moment. So here is the Spaulding classification. This is decades old and has been revised somewhat to account for new diseases such as prion diseases. And it looks at the cross-infection risk as a high, medium, and low. And under the Spaulding classification, how a device is disinfected or sterilized depends on how it's used. A non-critical device is something that touches intact skin. So a probe that touched intact skin, or for that matter, like a blood pressure cuff, would require low-level disinfection. A semi-critical device is a probe that, or another device that touched non-intact skin or mucous membrane, which would include the vagina and rectum. Those would be semi-critical, and as we'll see, that will require high-level disinfection. And then we have critical devices. That's any device that enters the intravascular system or enters a sterile tissue. And ideally, those should be sterilized or be sterile when used. So again, low-level disinfection for probes that contact intact skin or other devices. And of course, you can always use a higher level of disinfection these are what's minimally required. For semi-critical devices, it would be high-level disinfection. For critical devices, they ideally should be sterilized. But if that's not possible, they can be high-level disinfected and placed inside a sterile cover if placed into a sterile field to prevent contamination. Now, again, in the Spaulding classification, as you can see here, the level of disinfection and pathogens killed. So if you look at the pathogens which are listed on the left, at the top are the ones most resistant to disinfection. At the bottoms are the ones easiest to disinfect. You can see that sterilization is used in an absolute sense. It means complete elimination of all microbial growth. Low-level disinfection in the green arrow on the right includes envelope viruses. That, by the way, includes SARS-CoV-2, the cause of COVID-19, influenza A virus, and vegetative bacteria such as Staphylococcus aureus and E. coli. High-level disinfection then will cover the fungi, the small non-envelope viruses of a particular importance here, things such as norovirus and HPV, both of which would be found, could be found in stool. And it also covers mycobacteria, tuberculosis, and other mycobacteria. But HLD, while will often eliminate bacterial spores, may not completely eliminate bacterial spores such as Bacillus subtilis and Clostridium difficile, although it will be active in removing a number of those spores. So for non-critical devices, low-level disinfectants, as we mentioned, and for semi-critical devices, we want to use a high-level disinfection method that would kill all viable microorganisms except for small numbers of bacterial spores.